Hi, I'm Dr. Amitabh Sur. I'm working as a consultant endocrinologist at PLS Hospital, Kolkata. Today, we are here to discuss on a topic called "Are you at risk of diabetes?" So, friends, are you at risk of diabetes, or who is at risk of diabetes? Friends, our country, India, which is in Southeast Asia, is by virtue of its very nature, by virtue of its very presence, is at risk of all the Indians and people who are residing in Southeast Asia. They are at increased risk of type 2 diabetes because the genes which cause type 2 diabetes are seen increasingly prevalent in this subgroup or in this subpart of the continent. Type 2 diabetes is a metabolic and vascular disease. It is very important to diagnose type 2 diabetes at the onset because it has been seen that complications like cardiovascular disease, retinopathy, neuropathy, and nephropathy are seen even at diagnosis of diabetes. So, who are at increased risk of diabetes? People who are overweight, who have a BMI of more than 23, people who are having hypertension, people who are having dyslipidemia, people or women who had an history of gestational diabetes mellitus, people who have a family history in close relative of type 2 diabetes, they are at increased risk of getting the disease. Also people who follow unhealthy lifestyle, particularly people who are sedentary, who do not exercise regularly, or are into eating habits of fast foods like beverages, like soft drinks, like pizzas, they are at increased risk of getting this metabolic disease called type 2 diabetes. But above all, the genetic risk is supreme. Type 2 diabetes is found in people who are genetically at risk of getting disease more commonly than those who are not. So, how to look for, how to screen for this disease, or on whom to screen for this disease? So, as I mentioned about the risk factor of getting type 2 diabetes, all those persons who are at risk factor of getting type 2 diabetes, which I have just discussed, should be screened for type 2 diabetes. Apart from that, even in those who are not at risk factor of getting diabetes, for example, people who are not obese, or people who do not have hypertension, dyslipidemia, or even people who do not have family history of type 2 diabetes, they should also be screened for type 2 diabetes at least at the age of 45 years or beyond. In fact, there is growing trend of type 2 diabetes in young people, so probably the ideal age of screening should now be reduced to 35 years. The screening frequency should be at least 2 years if everything is normal. That is, if the patient or if the person is not having any evidence of dysglycemia. However, if the patient on screening, how do we screen patient, or how do we screen people? We do screening by using 3 test modalities: fasting plasma glucose, oral glucose tolerance test, and HbA1c. If the person's fasting plasma glucose is above 100 and less than 126 mg per dl, then this is called impaired fasting glucose. After an overnight fast and after taking 75 gram of glucose and checking the plasma glucose 2 hours after taking 75 gram anhydrous glucose, if the patient's plasma glucose is above 140 and less than 200, this is called impaired glucose tolerance. So, impaired fasting glucose and impaired glucose tolerance is called pre-diabetes because people who have this condition are not diabetic as such, but they are at increased risk of developing diabetes. Similarly, if you do an HbA1c, which is a 3-month average plasma glucose reading, HbA1c of 5.7% to 6.4% is also in pre-diabetic range. So people who are diagnosed to be having pre-diabetes should be recommended lifestyle modification about which we will discuss in our later video in detail in later part of this video. screening frequency for people who are being diagnosed with pre-diabetes is more. It is at least annually, if not more. However, if someone on screening is completely okay, he is not having impaired fasting glucose or impaired glucose tolerance, then for that person the screening frequency can be once in 2 years. So as we were discussing about various lifestyle issues, including as we discussed about that people who are living a sedentary lifestyle and people who are eating a lot of fast food like pizzas, burgers, soft drinks, etc., are at increased risk of diabetes. In this reference, I like to discuss the role of sugar sweetened beverages in little more detail. So what is basically this sugar sweetened beverage? The sugar sweetened beverages are any non-alcoholic drink, non-alcoholic water based drink with added sugar into it. It can include soft drinks, it can include fruit juices, it can include other energy drinks or health drinks like that. All the sugar sweetened beverages has been seen to be detrimental for health. Consumption of sugar sweetened beverages, even to an extent of 1 sugar sweetened beverage per day or 2 sugar sweetened beverage per day, 1 glass or 2 glass of sugar sweetened beverage per day, has been seen in various researches to increase the risk of heart attack by around 20 to 25%, increase the risk of type 2 diabetes by around 20 to 25%, being detrimental to bone health, being detrimental even to the neurocognitive functions. And most importantly and most commonly, these sugar sweetened beverages are widely implicated to do a dreaded condition called fatty liver, which we also known as non-alcoholic fatty liver disease. So sugar sweetened beverages should be avoided at any cost by anyone. Even if the patient is completely healthy, he should probably avoid taking sugar sweetened beverages.